Now, York, Toronto, Ottawa and Peel are all in a modified stage 2, but maybe not for long. Premier Doug Ford says he's instructed his health team to come up with a plan next week to begin lifting the restrictions in a safe manner when the 28-day period is over, which for Toronto, Peel and Ottawa is a week from tomorrow. Does that mean indoor dining and gyms will be back? We'll see. It sure looks like it.
I want the health officials to come up with a plan that lets business operate safely because we don't know how long this virus will be with us.
Yesterday's modeling projections indicate the pace of COVID is slowing, but the caseload is still going up. But it also showed restaurants and gyms are linked to a small percentage of outbreaks. The majority come from long-term care and retirement homes and schools, making many question if indoor dining and gyms needed to be closed at all.
I truly believe if we didn't make this decision, we would be having a different conversation today. We'd be having a conversation possibly like France or like Spain.
The province's Associate Medical Officer of Health says the number of outbreaks linked to restaurants and gyms in the hot zones was around the 30 to 40% range before the modified stage 2 kicked in.
Of course, now that you look at what you saw yesterday was a combination of the data for the last 2 months, and things have gotten better.
The Premier was under intense pressure from the health community to increase restrictions earlier this month, and he acknowledged not all of his MPPs agreed with his decision. The push and pull of being a Premier during a pandemic.
When you have 72 members, everyone has differing opinions.
The Premier has also asked his health team to come up with a more surgical plan. Instead of all of Toronto, for example, facing the same restrictions, he wants to target specific areas that are a concern.
I can't punish everyone and paint a broad brush. If there's just one pocket of a city or a town that's infected, it's just not fair to everyone else. We have a big city.
Epidemiologist Colin Furness agrees with a more targeted approach, but he's very concerned about the province lifting modified stage 2 sections.
I think we need to have the kinds of restrictions we have in place now that are very specific. That is, everyone's wearing a mask if they're indoors with each other, right? That does rule out dining. It does rule out certainly some gyms, maybe not all, depending on the activity. We're going to need to have that until, I would think, April or May. I worry that we are going to hurtle toward a generalized lockdown in January. That's what I'm afraid of. I think the Christmas holidays may spark that. And if we want to have, it's not okay to have 800, 900, 1,200 cases a day in Ontario. This is not okay. This is not the new normal. This is not acceptable at all.
Not so encouraging. Now, Premier Ford also confirmed today that there was a COVID outbreak at his constituency office. 3 staffers were impacted. They believe it was contracted from visitors who came to the office. He has not been there, so was not potentially impacted.